name's Christina. I'll be doing my wound dressing video for you. I have on my appropriate scrubs for school, my badge, no jewelry, and no nail polish. Okay, hopefully that's a good angle. All right, I have all my supplies. I have my clean gloves. I have my wound with the bandage already on. I have my sterile dressing kit, hand hygiene, and my biohazard bag. Okay, I'm actually gonna put this up a little bit so you can... Okay, we're gonna begin. Open the door. Hi, Mr. Smith. My name's Christina. I'll be your nurse today. Close the door for patient privacy. We're gonna go ahead and remove your old dressing, assess your wound, and apply a new one. How does that sound? Okay, I'm gonna go ahead and perform hand hygiene. Mr. Smith, can you verify your name and date of birth for me? Perfect, checked his wristband. I'm gonna go ahead and put on my gloves now. Okay, I'm gonna pull this closer. We're gonna go ahead and remove your old wound bandage now. When we remove that old wound bandage, we want to pull parallel with the wound to remove it so we don't tear it any further or any damage to the skin, especially someone with fragile skin. Again, pulling parallel with the wound. Okay, once we have that removed, we're gonna go ahead and toss that in our biohazard bag. I'm gonna move this back and we're gonna go ahead and remove our gloves. We want to go ahead and toss those gloves in our biohazard bag as well. Then I want to perform hand hygiene. All right, we're going to go ahead and open our sterile kit now. Okay, first thing I want to do is grab my sterile gloves out of the kit. Under this 1-inch border here. All right, I'm gonna take these 2 fingers and grab the cuff of my first glove, and I'm going to put my first hand in. Okay, we wanna make sure that the cuff stays on our wrist so it doesn't roll down. And with our other hand, we're going to use these 2 fingers, go ahead and put them into the cuff of our other glove and guide our other hand into the other glove. Okay, again, we want to make sure that cuff stays on our wrist so that we don't have it roll down. Okay, first thing I'm going to do is decide which hand is going to remain my sterile hand and which hand is going to become unsterile from cleaning. My left hand is going to be the remaining sterile. So I'm going to go ahead and grab the applicator first, drop it into my hand, and I'm going to go ahead and clean that wound from the inside out. After the first ring, I would want to throw it away and grab a new one, but I'm going to reuse it for the purpose of this video. Again, we want to clean from the inside out. Okay, we're gonna go ahead and dispose of that. Next, we're gonna go ahead and grab our gauze, drop it into our hand, and we're gonna go ahead and clean our wound, damping it. Again, we wanna throw that away after our first ring, but for this video, I'm just gonna reuse it. Damping, okay. Cleaning from the inside out again. Go ahead and toss that. All right, next we wanna assess the wound. We wanna use 2 fingers to palpate that wound. We wanna check here for any tissue granulation, any edema, redness, pain, any odor, discharge, any sign of infection. And here is if they had any tunneling in their wound, we would measure it at this point, but their wound doesn't have any tunneling, so it looks good. Okay, now we're gonna go ahead and grab the clear bandage out of our sterile kit. We're gonna go ahead and open that up. Toss that. Place it over the wound. Remove the outside of it. Okay, we want to throw that away. Okay, make sure it's on nice and tight. Okay, now here is where we're going to dispose of all the other supplies we don't need. First, our sterile kit we're going to toss. And then our gloving trash. And then we're going to go ahead and remove our gloves. Pinch the inside. Roll it up into our hand. Go underneath the cuff here. Pull it out. Dispose. Perform hand hygiene. All right, Mr. Smith, everything looks good. Are you in a comfortable position? Perfect. Okay, he said he's comfortable. All right, Mr. Smith, I'm going to go document my findings, and you have a great day. Close the door for patient privacy.